Today we are going to see about issues related to carbohydrate intake. Before we are going to see about the actual content of the topic, we will know about small introduction about carbohydrate intake. Indian diet consists mainly of carbohydrates in the form of sugar and starch and produce energy to meet the prime physiological demand of the body. Generally, 60 to 60% of total calories are mainly derived from carbohydrates. Even in disease condition, carbohydrates can be considered for consumption without having restriction or avoided, but care has to be taken in quantity and quality of carbohydrate in the diet. Cereals, pulses and roots and tubers contains complex carbohydrates which are converted into simple sugar during digestion and are absorbed from gut. On the other hand, sugar, honey, jaggery and jam contain simple sugar which are directly absorbed and quickly utilized. They are referred as refined carbohydrates and are not recommended for health conditions like diabetics, obesity and so on, as they cause a rapid rise in blood glucose level. Sugar present in fruits and milk raise blood glucose level at a slightly slower rate. Therefore, fruits can be taken in right quantity. After going through this module, students will be able to understand the nutritional quality of carbohydrate in the diet and different types of carbohydrates and their association with disease condition. Now we will see the nutritional quality of carbohydrates in the diet. A high proportion of calories from carbohydrate is generally desirable, provided that the carbohydrate must be complex carbohydrate. Such diet provide liberal amount of minerals, vitamins and fiber. By virtue of the low fat content, the risk of many degenerative disease like coronary heart disease is also reduced. Sugar is the concentrated source of energy and valuable for contributing palatability and variety to the diet. However, excessive intake of sugar, candies, sweets, bakery products and sugar containing soft drink is likely to reduce the quality and quantity of nutrients containing food, contributing to a nutrient deficit. High calorie diet as well as promoting overweight and obesity and invite many other health problems. For example, the increasing use of high calorie soft drink reduce the intake of milk incorporated beverages. The establishment of good eating habit in early stage of life with a judicious consumption of composite cereals, vegetables and fruits need to be overemphasized. Some people regard all refined sugar as harmful, while regarding other forms of sugar, honey, raw sugar, molasses etc. as satisfactory substitutes. Although the substituted sweetness may furnish some mineral elements, the amount are too small to be of significance in the diet. Carbohydrate reduction diet is needed to correct the disease condition like obesity and diabetic. From time to time, claims are made for effectiveness of low carbohydrate, high protein, low fat diet in bringing about weight loss. Such diet can be dangerous since they lead to ketosis with the associated clinical findings of excessive fatigue, dehydration, water loss and electrolyte deficits. Second aspect is the different types of carbohydrates and their association with disease condition. First one, carbohydrates and diabetic mellitus. Complex carbohydrates are broken down into simple sugar and are absorbed from gut in a normal manner, while simple sugar are easily digested, quickly absorbed and rapidly increase blood glucose level. it is recommended that a diabetic diet derive 55 to 65% of energy from complex carbohydrates. Now we will see the distribution of carbohydrates in the diet. Since blood glucose level depends mainly on the intake of carbohydrate, it is important to distribute the intake of carbohydrate in accordance with the daily needs. For example, in type 1 diabetic, it may be necessary to give additional carbohydrate before the patient goes to sleep to prevent hypoglycemia. If the patient is on slow acting insulin, distribution of carbohydrate in food should be tailor-made to suit individual food habits. The total daily intake of calories from carbohydrate, protein and fat in the diet for the diabetic should be distributed in the following manner. For example, 55 to 65% of total calorie should be derived from carbohydrates, 15 to 20% from protein and 20 to 25% from fat. Next component of carbohydrate is dietary fiber. Dietary fiber is the part of food that is not digested in gut and is considered as an unavailable carbohydrate. It is not a simple NET but consists of a wide range of complex carbohydrates. Fiber present in vegetables, fruits, legumes and fenugreek seeds are soluble in nature and is relatively more effective in controlling blood glucose and serum lipid compared to the insoluble fiber present in cereals, millets and pulses. However, long-term consumption of insoluble fiber also improves glucose tolerance. Diet containing high dietary fiber can reduce blood glucose and serum cholesterol and also relieve constipation. In addition, dietary fiber is beneficial for prevention and treatment of several other diseases like diabetic, cardiovascular disease and so on. Now we will see hypoglycemia. People sometimes make self-diagnosis based on what they have read and heard from the pseudoscientists and attempt to treat themselves with a small carbohydrate diet resulting in hypoglycemia. The symptoms of hypoglycemia develop when the blood glucose level falls to 40 milligram per deciliter. If insulin is administered to this person, the blood glucose level rapidly falls. Symptoms of hypoglycemia are extreme hunger, palpitation, tremor, fainting, mental confusion, weakness, trembling, headache and if severe, coma will occur. The diagnosis, however, can be made only by a physician who relies not only on presenting the symptoms but also on the glucose tolerance test with multiple blood samples taken over a period of several hours. Since the nervous system depends on glucose for its metabolism, reduction in glucose supplied to brain causes the symptom narrated earlier. Hypoglycemia is a serious condition and can cause damage to brain. Hypoglycemia induces the secretion of adrenaline and this in turn causes tachycardia and tremor. Adrenaline, by mobilizing liver glycogen, tries to overcome glycemia. If coma has set in, the patient should be given an intravenous injection of 25 gram glucose, that is 50 ml of 50% glucose. This may have to be repeated. When the patient regains consciousness, he should be given 50 gram glucose dissolved in 200 ml of water orally. Second aspect is related to carbohydrate and weight management. Weight management requires for both underweight and overweight or obesity. Overweight or obesity is due to positive energy balance. The intake is more than the expenditure of energy. Obesity is the state in which there is a generalized accumulation of excessive adipose tissue in the body, leading to more than 20% of desirable weight, and in overweight the body weight is 10 to 20% greater than mean standard weight for age and sex. Now we will see carbohydrate and obesity. Among general public, obesity is a great focus of interest for aesthetic reason. It is also a focus of concern among public health authorities because it is an independent factor of risk for lifestyle disease. Obese individuals are at risk of contracting non-insulin dependent diabetic mellitus, cardiovascular disease, disorders of gastrointestinal tract, and some types of cancer. Therefore, the most promising approach for reducing the incidence of these lifestyle diseases to reduce the incidence of obesity. On an individual basis, a key strategy in seeking to improve health and prevent non-communicable disease conditions related dietary lifestyle is to encourage the prevention of excess weight gaining leading to obesity, or if obesity is already present and particularly if it is of the type that is centrally distributed in the body, to embark on a program to lose weight permanently. Basically, obesity is a chronic disease that requires long-term treatment. Even a 5 to 10% loss from initial weight may produce marked improvement in disease condition like diabetic, dyslipidemia, and so on. The initial goal of weight loss therapy is to reduce body weight by approximately 10% from baseline. Energy restriction for weight reduction is simplest and safest effective method. 1 pound of body fat is equivalent to 3,500 kilocalorie. Therefore, intake must be reduced by 500 kilocalorie daily to produce a loss of 1 pound of body fat weekly. A calorie deficient of 1000 kilocalorie per day is required to lose 2 pounds or approximately 1 kilogram of body fat weekly. This is the maximum weekly weight loss recommended since a more restrictive diet may not be nutritionally adequate. For example, reducing excessive food sources of sugar and simple fat can dramatically reduce calorie for many overweight people, and generally guidelines to accomplish such a change may be as effective as a specific meal plan. Regardless of the method chosen to reduce body weight, the patient must be eventually learn to eat a healthy diet to maintain body weight. Next aspect is related to carbohydrate and underweight. When considering underweight and or undernutrition, diet modification consists of high calorie, high carbohydrate, high protein, high fat, and adequate vitamins and minerals are recommended. But before going to adopt high calorie diet therapy, the first therapy is to determine and eliminate the cause for undereating. Then the balanced diet should be planned based on the requirement. In the diet therapy, high carbohydrate sources must be formed the base of the diet. For example, fibrous vegetable, green leafy vegetable should be restricted and preference to be given to potato like carbohydrate rich foods. Simple and easily digestible high calorie foods to be included in the diet for easy digestion, quick absorption, and rapid utilization. For example, porridge, desserts, cutlets, chips, high protein drinks like milk, malted milk and badam ghee can be included. The correction of negative energy balance is essential cornerstone to increase body weight for their health and well-being. Third one, effect of excess sucrose and fructose on blood lipids. Studies carried out by several workers have reviewed that when more than 50% of starch in experimental diet is replaced by sucrose or fructose, there is a marked increase in blood lipids and is observed in experimental animals. The effect of sucrose is due to presence of fructose. Fructose is more rapidly converted to glycerol phosphate than glucose, the other monosaccharide in sucrose. The presence of glycerol phosphate involved in the synthesis of triglyceride and are responsible for the occurrence of coronary heart disease. Next one, carbohydrates and coronary heart disease. Diet modification remains the first line of treatment for the patient with high blood cholesterol level. Low calories, low fat, particularly low saturated fat, low cholesterol, high in polyunsaturated fatty acid, low carbohydrate and normal protein, vitamins and minerals are suggested. High fiber diet is also recommended. The total calories should be restricted so as to reduce the weight to the expected normal weight for age, sex and height. Only complex carbohydrates should be included in the diet since total calories are restricted. Carbohydrates intake can increase fasting triglyceride level. By restricting carbohydrate intake, serum triglyceride level can be controlled. Carbohydrate intake should be limited to 60% of total energy in patients with metabolic syndrome. Next one, development of cataract due to excessive lactose or galactose. Studies carried out by Day in 1936 confirmed that feeding rats diet high in lactose or galactose leads to the development of the type of cataract and also determined the blood sugar in rats consuming diet containing 60% of various carbohydrates. In rats consuming 60% of lactose or 60% of galactose ration, the mean blood sugar level were 160 and 372 milligram per deciliter of blood respectively. Of 18 rats on lactose ration, 17 developed cataract at an average period of 44 days. 3 rats given the galactose ration showed cataracts on 11th day. None of the animals eating the ration containing sucrose, glucose or starch showed cataracts. In diabetic mellitus, the incidence of cataract is higher than in healthy person. Recent studies have shown that the cataract is due to the formation of diastole, that is the alcohol from galactose in lens. This formation denatures the lens protein, making it opaque. In this lactic fermentation, the glucose, the part of lactose is fermented to lactic acid while the galactose is left behind. These aspects are responsible for the development of cataract. Now we will see the effect of excess fructose on uric acid in blood. Administration of fructose intravenously leads to an increase in plasma uric acid level. This has been used as a screening test for gout. The reason for the increase in urate production is probably due to the rapid phosphorylation of fructose in the liver, thus decreasing the level of ATP, and this in turn causes the breakdown of AMP to the free base, which is converted to uric acid. In susceptible individual, retention of uric acid sometimes leads to symptoms of gout. The reduced carbohydrate and increased supply of fat, especially saturated fat, may result in elevated blood lipids and increased risk of coronary heart disease. Low carbohydrate diets are also low in fiber content. Next aspect is carbohydrate in relation to behavior. Interest in the relationship between nutrition and behavior has focused on many nutrients, including the kind and the amount of carbohydrate in the diet. Many unconfirmed exhibit a shortened attention span and a high level of activity inappropriate for their age after eating sugar. However, it is good to keep in mind that this behavior often follows the use of ice cream or candy, often eaten on special occasions that might be stimulating a child to have it. Controlled studies have failed to show that sugar has an adverse effect on behavior of the children. Next one, fermentable carbohydrates and dental caries. Carbohydrate is one of the major factors implicated as a cause of dental caries or tooth decay. Before the tooth erupts, it is nourished through a blood stream. Therefore, carbohydrate has no direct effect on tooth health. Carbohydrate has an indirect and adverse effect on tooth before eruption only. When the diet contains simple carbohydrate with the exclusion of foods providing nutrients such as calcium, vitamin D and C, all of which along with fluoridated water ensure the health of developing tooth. After erupting, the teeth is exposed to oral environment and has only limited connection to the blood supply. Carbohydrate, both sucrose and starch, began to assume importance in tooth health at this stage. The tooth decay occurs when both microorganisms and carbohydrate, which serve as a food for them, are present. Carbohydrate in the solution do not adhere to the tooth surface and therefore cause relatively little harm. However, sucrose-rich foods such as caramels and gummy starch turn to adhere to the teeth surface and provide ample food for bacteria. The bacteria are able to convert this food into polysaccharides known as dextrin, which adhere to the teeth surface and form dental plaques. The plaques is in turn to attract sucrose. Once it is in the plaque, the microorganisms called Staphylococcus mutans acts as the sucrose to produce acid. As the acid accumulates, it causes tooth enamel to dissolve and tooth to decay. Dental caries. The cause for tooth decay are many and complex, yet dentists agree that sugar is the one of the important etiological factor for bacterial growth, which leads to gradual build-up of plaque. A sticky carbohydrate bacterial matrix that adheres firmness to the teeth. The acid formed by the bacteria from sugar substrate gradually erode at the tooth enamel and bring about decay. The two conditions accelerate the process of dental problem. One is the sticky carbohydrate that adhere to tooth surface to sugar. For example, the sticky caramels are likely to be more harmful than a soft drink providing the same amount of sugar, since the latter is less likely to adhere to tooth for a long period. But also, eating 5 caramels at 5 intervals during the day results in 5 exposure, while Eating the 5 caramels at one time would reduce the total time of exposure. Now we will see that sucrose and dental caries are interrelated. When high amount of sucrose were fed in solution, the increase in dental caries incidence was barely perceptible. However, when sucrose was fed in the form of sticky candy such as toffee, there were marked increase in the incidence of tooth decay. Comparable amount of sugar in chocolates or in bakery products like bread causes intermediate increase in dental caries occurrence. Next one is implication of sugar in other problems. High carbohydrate diets perceived do not cause diabetic, nor is there convincing evidence that sugar will cause it. But there is a high association between obesity and maturity onset diabetic mellitus. Thus, calorie control rather than limitation of a carbohydrate alone is the most important factor in delaying the onset in susceptible individual. The contribution of high carbohydrate intake to elevation of blood triglyceride is controversial. Again, the person who are obese are more likely to have elevated blood triglyceride. Some persons are genetically predisposed to hypertriglyceridemia and may be carbohydrate sensitive. These individuals are usually advised to restrict their intake of sugar and of alcohol. From the nutritional point of view, increasing the consumption of high carbohydrate foods in replacement of high fat foods may be good starting point to reduce the distribution of fat in the body for the occurrence of obesity. Foods are high in carbohydrate, particularly when they are high in dietary fiber, also had the most impact on reducing hunger and considered to be the most helpful in reducing energy intake, thereby preventing the incidence of overweight and obesity. Losing weight is a question of interesting less energy than that which is expended, and this can be only achieved by a lower energy intake and increased energy expenditure through increased physical activity or both. The next one is lactose intolerance. Some adults other than those of Northern European ancestors may be unable to tolerate of a intestinal lactase activity causing malabsorption of lactose. As the unabsorbed lactose accumulates in the intestinal lactase activities causing malabsorption of lactose. As the unabsorbed lactose accumulates in the intestinal tract, fermentation produces erupting and diarrhea. Although adults may be unable to drink milk, infants are usually lactose tolerant and will thrive on milk formula. Children and teenagers can drink sufficient milk to meet their calcium requirements. If the intake is well spaced throughout the day, to eliminate milk from the diet of all children belonging to ethnic group having high incidence of lactose intolerance is a nutritional disservice. When there is an indication of some intolerance in children, a determination should be made regarding that the levels of milk that can be tolerated. Conclusion: a wide range of carbohydrate containing foods be consumed so that the diet is sufficient in all essential nutrients as well as total energy. Appropriately processed foods like cereals, legumes, vegetables, etc. are particularly good food choice to maintain health status of an individual.